Losing myself, I'm losing myself tonight.
Hello, everyone. Welcome back to another episode of Rare and Real. This is episode 4. My name is Nate Milam, and I'm here with my wonderful co-host.
Hey, it's Carter Hemian. Thanks for joining us.
And we have a very special episode for you, all of you today, celebrating Histiocytosis Awareness Month in September. My wonderful friend and fellow patient advocate, Brinda Shukla, is here, and I will let Brinda do a brief introduction before we get started. We have a very exciting episode for you today. So, Brinda?
Yeah, so first of all, thank you guys so much for having me. I'm so happy and ecstatic to be on and get to chat with you guys today. A little bit about me. My name is Brinda. I am 22 years old. I turned 22 a couple weeks ago, so it's very exciting. I am currently a first-year medical student, and I am a rare disease survivor. And specifically, I had a form of histiocytosis called Rosai-Dorfman Disease. And yeah, that's a little bit about me.
Thank you. Yes, we are twinsies in the histio department. I'm very happy to have her today. We have a list of questions. You guys are going to see me look to my whatever direction this is, right or left, occasionally to read the list of questions that I have. A bit of a different setup scenario than we've been doing. Carter and I have pretty much been winging it, kind of doing it from memory, but for the structure, for this to kind of be as together as it possibly can, I'm going to read off some of these questions. And yeah, so we'll get started. So, question 1, Brenda, can you take us back to the beginning? How did your journey with RDD start?
Yeah, so my journey with RDD. So I was ultimately diagnosed in February of 2017, but my presenting symptoms started before in the fall of 2016. So think around September, October, around that time. So around August, September-ish, I started noticing that I was having a bit of unintentional weight loss. I was fatigued, so I was napping a little bit more than usual. And actually, I've never been a napper, so this was a little bit out of the ordinary for me, having to take a lot of naps. I had a lot of hair thinning, so I had very thick curly hair, so that was a noticeable stark difference, just seeing some hair thinning and a lot of hair loss as well. And I was described as looking very pale, so that was one of my presenting symptoms. And then the most concerning presenting symptom was I noticed a lump right in front of my ears that was kind of bulging out a little bit. I noticed this end of September around that time. I didn't think much of it, so I didn't think to tell anyone. I was like, this is probably nothing. And then in October, that's when my mom noticed. And then when mom noticed, that's when this diagnostic journey began, when she got me in to see a pediatrician and then bouncing through specialties from then until February.
Awesome. And I don't know if we went over this before, but just before we continue, I wanted to let everybody know the different types of histio, because I have HLH and Brinda has RDD, and those are only 2 of the few that we have, and discoveries are still being made. But just to recap with everyone who doesn't know about histiocytosis, there are a few different types. So think of histio as the tree, and the different types as the branches to the tree. So you have HLH, which is hemophagocytic lymphohistiocytosis. And I won't say the exact names for all of them, but I will say LCH, JXG, ECD, malignant histiocytosis, and also Brinda's RDD. And do you want to just quickly explain to everybody what exactly that entails or what that is?
Yeah, so RDD involves the overproduction of histiocytes, which is a cell found in our body. I don't know what the exact function is of the histiocyte. I should probably know, me being a first-year medical student, but that and several other histiocytic disorders involve this abnormal overproduction of these cells as well. And the differences really lie under the microscope. So that's how these diagnostic distinctions are made when the pathologist looks at the tumor slide, tests these various different markers and stuff like that. So that's a key distinction between the diagnosis of ECD, LCH, and RDD. So RDD was just the most recent histiocytic disorder to joined the designation of being a rare blood cancer. And that was back in 2022 when the World Health Organization recognized RDD as a rare blood cancer. Researchers found this MAPK mutation present in a lot of these cases. So that's where that distinction came from. And it is described as a very slow growing blood cancer. And typically, RDD is not life threatening, and that's in majority of the circumstances.
That's interesting. I did not know it was the latest to join the
Mhm.
roster.
Yeah,
That's really cool. And RDD is Rosai-Dorfman disease, right?
correct.
Rosai, am I saying that right? Okay.
Yes.
So thank you for giving us that insight, Brenda. I want to ask you what symptoms or signs first made you seek answers? I mean, I guess you kind of covered that with your hair thinning and things. When your mom noticed your symptoms and was like, this, we need to go, do you remember what symptoms she was particularly most concerned about?
Most like concerning symptom was the lump that was like just bulging out on like this side of my face. So that was definitely the most concerning. And then she just kind of started putting pieces together. She's like, okay, she's been tired and losing weight unintentionally. I wasn't trying to lose weight. And then that's what really motivated her that, okay, we need to go to the doctor. And I was a very healthy kid. Like this was very out of the ordinary for me. I would only go to the doctor maybe once a year just for like a pediatrician checkup. And that's when these symptoms is what led us to going to see my local pediatrician at first.
Okay. And did they biopsy the lump? How did they
Yeah, yeah.
diagnose?
So definitely. Yeah. So my biopsy, I ended up having two separate biopsy procedures. The first one was not done right away. So we went and saw the pediatrician didn't really think much of it, but my mom was like, no, something is not right. And then I ended up getting a referral to see a pediatric ENT doctor. They suspected some sort of infection. I did a course of antibiotics, wasn't working. My symptoms were getting a little bit worse. I was getting fevers here and there too, so that became a little bit more concerning and was still dropping weight. And then whenever the antibiotics didn't work, we went back to ENT. Then they did a CT scan, and that scan showed that I not only had the lump that was bulging out here that we could feel, but I had several other lymph nodes around like my cervical chain area and my neck as well. And then that's when the ENT first floated the word cancer. So that's when that first came into discussion. And then he was like, this could be some sort of lymphoma. And then we were like, oh my goodness, like we were definitely freaking out at this time. Then fast forward to around, I believe it was like end of November, early December of 2016. That's when we got an appointment for me to have a needle biopsy on a lymph node here in my neck. They weren't going to biopsy the really like the big and bulging one just because it was so close to my craniofacial nerves. So if the needle accidentally nicked something, that would have been bad.
Yeah.
So this was a much safer area to biopsy compared to the bigger lymph node. And I ultimately had that needle biopsy and it came as like inconclusive. Nothing came from it. So then the idea of cancer then kind of just like got shifted back on the back burner. It was like, okay, this is probably not cancer. And then in January of 2017, I landed in pediatric infectious disease, thinking this could be some sort of infection or like viral related thing. I did more antibiotics, still nothing worked. Symptoms were still there. Had an MRI just to see if things were like lymph nodes and stuff were still there. Everything was still there. And then after I had the needle biopsy, the lymph node here grew. So this one was also now bulging out of my neck.
Wow.
So then yeah, so MRI still showed that like this one had grown basically, but other than that, there were like no other lesions. Everything was still pretty much like stabilized. And then that's when the pediatric infectious disease doctor transferred me over to oncology. And then they were like, oncology was like, okay, let's biopsy like this lymph node right here. So then in February, got a surgical biopsy. They took out the whole lymph node. And then the surgeon was telling my parents there were a few other little ones nearby. They took that one out as well. And that's how I got my Rosai-Dorfman disease diagnosis.
Wow. It sounds like it was a bit of a process, right? What was the final stretch where they were like, okay, these results may seem inconclusive and we're giving her treatments that aren't working? How did they make the decision, or what I guess, test or indication really confirmed the RDD for you?
Definitely the biopsy is what for sure the full surgical excisional biopsy, not just like sticking a needle and taking a little bit of like tumor sample and a little bit of fluid out. The whole like excisional biopsy is what ultimately came to the correct diagnosis. And then I guess that pediatric infectious disease doctor that I saw prior to landing in oncology, I believe this physician said that okay, if like these antibiotics don't work, maybe getting an oncologist opinion on how we can excise this lymph node would be the best next step. So I'm glad that provider referred me to oncology because that ultimately was the best place for me to be.
Yeah. And can I ask you, just for people who may not know, I'm not super, I know what a biopsy entails, but when you say complete excisional biopsy, what do you mean by that exactly?
Yeah, so there are several different types of biopsies. So there is a needle biopsy, which is the first one I said I had that came back inconclusive.
Right.
It is a generally an outpatient procedure. So they basically numb the area, they numb the site, and then they take a needle and then they put it into the area and then try to pull out, like I guess that's the best way to describe it, pull out a little bit of like the tumor sample, nearby fluid, and then they'll take that to the lab, check it out under the microscope, and come to a diagnosis from that way. Usually, a lot of common cancers can easily be diagnosed from this way, but a needle biopsy is not that diagnostically accurate. Like, it can sometimes miss things, basically.
Right.
So, then we have a surgical excisional biopsy. So, basically, you're put under general anesthesia, and then the surgeon will go in and try to remove the whole mass and try to remove complete margins of the mass and try not to miss anything. That way you have a bigger, bit of a bulkier sample and you can get a better look at it under the microscope when the pathologist is looking to try to make a diagnosis.
Okay, awesome. Thanks for letting us know, Brinda.
Yeah, I hope I explained that well.
Yeah, no, no. I mean, I understand. I don't. Yeah, Carter. Yeah, I think you did very well. I don't know if I've had any biopsies like that. I think most of mine have been needle biopsies. So those are like the ones that I'm most familiar with. I feel like maybe most people, when they think biopsy, they may think of that image, but just for visual purposes, I wanted to make sure
Yeah.
we distinguish the differences between the two. And before I pass the mic to Carter and let him take charge, and as we get into shift into some different style questions, I did want to just ask you what kinds of words you use to identify or describe yourself. And, for example, some may identify as having a health condition versus disability. Do you have personal feelings towards the way, the descriptive language is used and the way that you are perceived in society? Like,
Yeah.
how would you identify yourself for everyone?
Yeah, so a little bit like a few words that are used to describe my personality that I view myself and how others have described me as very loving, very compassionate. My humor is very sarcastic. I'm very sassy and witty. So those are like very like important and fun parts of my personality. I'm
Yeah.
very social, outgoing as well, and my most favorite word that I could use to describe myself is very motivated. Whenever I put my mind to something, I will make sure it happens and I will try to overcome any challenge that comes my way. So the best word that I would describe myself would be motivated.
Awesome, awesome.
Yeah.
Okay, and I'm gonna pass it over to my wonderful, wonderful co-host Carter as we get into our next set of questions for you. Carter?
Yeah, I actually want to ask you something a little bit off the chart here. You talk about like being very motivated, having your sense of humor. It sounded like your mom was also a strong advocate for you.
Oh, for
Wondering
sure.
what helped you with moving through this. And I mean, it must have been challenging.
Yeah, for
You
sure.
come out like very strong and
Thank you. Yeah, it was for sure very challenging. My parents were my rock throughout this whole diagnostic journey and then navigating the treatment journey and then like more so the phase I'm in now, which is navigating life after histio. So my parents have for sure been a really big constant and a big support in that. So I definitely pull a lot of my strength and resilience from them for sure. So yeah.
I'm glad you've had so much support along the way.
Yeah.
What's something that people don't often ask you about your diagnosis that you wish they would, or something you would want people to know about this journey?
Ooh. Okay, so in my journey, it was very isolating, and I don't get asked that a lot. How did you feel? Have you been able to connect with other patients that knew what you were going through? Now I am very connected in the histio community. I'm very involved, but from the time of 2017 up until the year of 2022 when I discovered the Histiocytosis Association, I knew no one that had histio in that 5 year pocket of time, and it was very isolating, like very, very isolating. I almost wish I knew what resources to seek out at that time, being 13 years old and then navigating histio and building that community at that time. I think that would have been very beneficial for me to have support then, and I really think that's what I needed at that time, was just a sense of community. And I'm definitely so grateful that I now have a community. Whenever I describe how the Histiocytosis Association has changed my life, I always say that it's healed the 13-year-old me. And now I have this community. I have so many lovely friends like Nate, and I get to meet so many amazing people in this rare disease space. So definitely the isolating feeling that comes with navigating a rare disease is what I wish people asked me more about.
Yeah, I think that's something a lot of us share as we navigate rare diseases. It's that feeling of isolation or not really feeling understood. How has this journey or your diagnosis impacted how you feel about yourself?
Yeah, so rewinding to early teenage Brinda, I was not able to really sit with my thoughts and reflect how the diagnosis connected to me, like personally, because I was genuinely in like a fight or flight mode. From eighth grade all throughout my 4 years of high school, I was missing a lot of school, trying to teach myself the material that I was missing. I was taking the top most level classes that were offered to me. I was trying to balance being a good friend, a good daughter, a good patient, going to these doctor's appointments, trying to take care of my health and balancing school. I was involved in so many school extracurricular activities. And on top of that, I was in my school's marching band. So that physically as well exhausted me even more. So I think I was just trying to, that was my way of coping at the time, was to overfill like my schedule to the point where I won't sit and think about what's going on in the background. And that's this histio, like this problem basically. So during that time, I really didn't know like what this meant for me. Like I couldn't put into words how I was feeling just because I was constantly in go, go, go mode. Then I get into college, which is, we're coming up on 4 years now from when I entered freshman year of college. I get to college. Things slow down a little bit. I'm not as involved, and then I'm just taking classes. I'm able to sit with my thoughts more because things have slowed down. And then that's where the racing thoughts started, the uncontrollable thoughts, and that I didn't know how to make sense of. And I didn't know how to process this. And I feel, looking back now, that was my first taste of my journey with anxiety and maybe even a little bit of mild depression as well at that time. And I really, from now, like reflecting on that time, I think the racing thoughts and the anxiety, that was from everything that I had experienced with my health coming out in really weird ways now, because I didn't have a chance to truly sit and process it as it was happening at the time, just because I was so busy just trying to do other things that were kind of important and some not as important things. But when I had time to sit with my thoughts, and then that's when all of these uncontrolled anxieties and like genuine upset about what had happened started to come out. And that really had a detrimental impact on my first few years of college experience. Basically, everything about my personality, I just became so much more withdrawn. I felt ashamed of my histio diagnosis. I didn't want to share anything with anyone. I didn't want to make friends. I was just like, I had horrible mood swings. Like it had gotten very bad and very overwhelming those first few years. And then ultimately I knew that I needed to make a change in my life and try to seek some help. And then that's the first point where I was like, it's okay to ask for help, was whenever I started seeking out therapy and counseling. And then I eventually, my junior year of college, I started seeing a therapist and getting some guidance from her. And that has truly changed my life. And I have a very good mentor as well. And he's been giving me guidance on how to own my histio diagnosis. And I really think these past 2 years, I've made tremendous progress. And so now my self-confidence is back again. I feel like courageous. I feel proud of my histio diagnosis and am now more open to sharing with others, which is why I'm happy to be here, and talk with you all. So yeah, it's definitely been a tumultuous feeling and relationship and how I've viewed having this rare disease. So if that makes sense, it's been very, very difficult, but I feel like now I'm able to process everything and now have this sort of openness about my histio journey.
That's incredible, Brinda.
Thank you.
And it does make sense. It's very, very complicated and just it's a roller coaster is actually what it is.
Yeah.
I have a couple questions for you though. Things that stood out to me. First, you said you were in band. What instrument did you play?
Okay, I didn't play an instrument, but I did color guard. So if you see a football game and you see the little girlies with the flags, yeah, that was me.
Arguably the most important role. I feel like that's really fun. Did you have a good time?
It was so much fun. I met some of my best friends through that activity. And yeah, it was so physically exhausting. And there were times where I couldn't go to practices because I wasn't feeling well, or couldn't go to games or competitions or whatever. But overall, it was definitely the highlight of a very dark pocket of time. And it helped me navigate high school and genuinely have a good time, which is what normal teenage life should be. Not having to balance having a rare disease, but then also I get to go and dance with my friends and perform with my friends. So that was truly a light in those 4 years.
Yeah, I didn't join band, but I did play the clarinet in high school, I think. If I'm remembering correctly. Carter, did you play any instruments when you were in school?
I was someone who also really leaned into music and dance to cope with everything. I was more of an orchestra kid. So I started on violin and picked up some other instruments along the way.
Very cool.
My other question for you, Brinda, you pointed out that you wish you had known how to look for the resources or what resources to be looking for when you were 13 or young, going through this. Now, I have, since being in the community, learned that, of course, everybody finds the association in their own time, but it's not a new structure that just popped out of nowhere. When I was diagnosed with HLH, it was 2018, and the Histiocytosis was around, you know what I mean? So, but up until, even all through treatment, it wasn't until after I got my transplant that I actually, started learning about the association and the fact that there was more resources out there. So my question to you is, first of all, I can relate to this. Second, why do you think that is? Because I know I get a bit, not fearful, but I question, what is the reason behind me not reaching out or Googling if there's an association or anything like that at the time. And I haven't really had this conversation with anybody else before because, but I'm just curious, not that I don't think it's a bad thing that, we were late to the party. Just sometimes things happen. I'm wondering, for you in your situation, do you know what kind of was the reason behind you not, or even your parents, kind of finding those resources at the time?
Yeah, so it's very interesting because my headspace at the time is I just kind of wanted to handle things on my own. I wanted to just have that sense of okay, let's just toughen it out and get through it alone. And that's really where my struggles with not asking for help when needed came from. And that's something I really had to get over in college, and accept that it's okay to ask for help. And that's what actually prompted me to, in 2022, wanting to do more research and find a community. Because in my head, I was I do not want to do this alone anymore. I don't want to deal with these isolating feelings alone anymore. I need a community of people who can relate as well. So that's what prompted me to reach out. But I definitely think the reason why I probably didn't seek out any sort of like the association or any other resource was just because I was like, okay, I need to figure this out. I want to figure this out on my own. But now reflecting back, I really wish I would have sought out that community much, much sooner, because it would have been, I definitely would have been less painful of an experience for me for sure.
I agree. I also wish that I had started out sooner, and I think for me personally, I didn't, or I didn't always. I wasn't. Yeah, we didn't. It was me and my mother as well. So I didn't really know. We didn't really. I don't think go digging for such a resource. Not that we didn't do any research at all, but I think there was so much going on with like the care aspects of it all, and for a long time, it was just such a tumultuous journey of procedures and things. So there was a lot of trust placed in the doctors. And so we were like, okay, we're already dealing with so much stuff. And I don't even think our minds thought to like go looking. It's like you don't know what to look for if you don't like even have the thought to be looking for anything.
Right, exactly.
If that makes sense. And then it's like, okay, but yeah, like in my now, having the resources that we do have and being connected to the community, I have noticed that, they are of course, they're very helpful. And the sooner they're introduced in the journey, I think the more help they can be. Mm-hmm. So I'm just like, in an effort to like try and help histio patients or patients in the hospitals right now who maybe are being considered for a histio diagnosis and may not be thinking to be doing any research or whatever, or looking for a specific home to house this rare disease. I just hope that physicians are more proactive in educating patients and letting them know that these resources exist, especially if they are aware of that fact. But do you have like maybe a message for anyone who may be listening to this about how to find resources and I guess the benefit, or just there's lots of resources out there even beyond the Histio Association, but you won't know I don't think we should be expecting patients or relying on all patients to just like go and find them on their own. I think there should be some guidance there. So I'm just wondering, like, what would you say to families, in this position right now?
Definitely, I would for sure encourage patients and families to definitely ask their provider if they can do some digging and find some resources on the provider end that can be offered. I wish my provider at the time had offered me resources, but I get it. It's a rare disease. Maybe they may not even know what to specifically look out for. So definitely, it's for sure. First, I would say it's worth having a conversation with your provider and asking if they're aware of any resources. And then honestly, for me, my first connection, like how I like got involved with the Histio Association, was on Instagram. I just looked up histiocytosis and I found a fellow ambassador posting on Instagram and I DM'd her. So I just needed that first like instant connection. And then that's then how I eventually got connected to like Diana and then Melinda. And then that's how I came in my role as ambassador. So also definitely social media helps a lot with that as well, I feel like.
Right. Yeah. I wish, just looking back now, I really wish I had done that sooner. But yeah, I just want people to know that like these resources do exist and there is no shame in like when you find them. It's just like now that I know that these resources exist, I try and use my knowledge and my whatever platform that I'm trying to grow and let people know ahead of time, like, these places do exist. Like, hey, if for anyone out there who was me and not even focused on searching, but I do kind of want to hold doctors to a bit of a higher standard. I do think that if you at least are treating or you are aware of a rare disease, if you're aware enough of the rare disease to be diagnosing patients, then you should be aware enough of the resources to give them as well. So I just want to say that, for any doctors listening to this, it would be great if patients could, upon diagnosis, a couple of days after diagnosis, when they have time to process, just provide them with at least more things than hospital guides and things. I use resources that were in the hospital, but I didn't learn about the association until someone told me about the scholarship, and that was years later. So, yeah, just wanted to go over that little bit tidbit. But my next question for you, Brenda, shifting gears a tad bit, you shared the opening up about your diagnosis hasn't always came easy. Can you give us a bit of a deeper inside look to that, as much as you feel comfortable? And
Yeah,
then follow up to that, how has that hesitancy impacted your experience personally?
yeah. So, rewinding a little bit, in middle school and high school, when I was going through the bulk of this journey, I was pretty open about it because I was missing a lot of school. Classmates, and with like good intentions, of course, were asking what was going on. And then that's when I was like, okay, let me post a little bit about my journey on Instagram here and there and just kind of like to let my friends and classmates give them a little bit of a glimpse into what is kind of going on when I'm missing school, why I'm missing school, and to kind of spread awareness a little bit for Histio as well. Then eventually, in my transition from graduating high school before going to college, that's when things started getting a little bit difficult. And then in my head, I don't know what switch just kind of flipped. And I was like, no, I need to be private about this. I can't tell anyone about this. I can't let my college peers know about this. I don't want them to have like to label me or anything like that as like a sick kid, or like I don't want any of these preconceived notions. I don't want anything about like me to be that anyone in my college peers could like try to like manipulate, or I don't want to give them any insight into my life basically. And then I took all the posts down during that time before people from college started like requesting to follow me on Instagram and all that kind of stuff. And so I think that was like the first part where like I started shutting down a little bit in terms of sharing my diagnosis. And even at home as well, I wasn't sitting down with my mom and dad and telling them how painful this felt for me because I could see how much it pained them. So I was like, it's not worth sitting down and having a conversation that just causes the three of us so much pain. And luckily now we're able to sit down, the three of us talk, reflect everything that happened through that period of time. And so it's better in that sense talking with them now. But I didn't even want to share that I was struggling back then. And then, as I shared a little bit earlier, then going into college, I was able to sit with my thoughts a little bit more. And because life had slowed down, and then I just became very withdrawn and held my cards very close to my chest. And I really feel by doing that, I missed out on probably a lot of really great connections in undergrad. Yeah, I had like I made like amazing friendships, but those mainly developed the latter half of my college experience. So socially, my junior and this past year, my senior year, I was doing great. I was hanging out with friends and like genuinely having like what the college experience should be. But those first 2 years, it was very, very difficult because just I was just so closed off, and it was just so unlike me to be that closed off.
Yeah, I don't know if I can imagine that. Like just from knowing you and like what I know of you today, I appreciate you opening up about that
Yeah, of
because
course.
I think a lot of people can relate to that. So following up with that, did that have an impact on your ability with accessing care?
Like my in terms of like the rare disease diagnosis, or just not being open per se of.
In terms of, yeah, I guess so. Was this hesitancy in opening up about your diagnosis? Was there a line where it stopped to like social life, or did that ever play a role when you were needing treatment?
I would say mainly after I finished, like, and I forgot to mention earlier, for the Rosai-Dorfman, I did steroid treatment and then was just being monitored kind of after that. But mainly navigating life away from pediatric care into adult oncology, it didn't impact me from seeking out care because through the Histio Association, I was able to find adult care, and now I see like oncology yearly just as like a check-in, pop in, say hey, how are you doing type of thing. And so that's really nice in that sense. But I think the most impact it had was socially for me, for sure.
Do you remember when the transition was between peds and adults for you? I know it's different, like different institutions, different places.
So I believe I stopped seeing pediatric oncology, I want to say sometime in 2021, I think, or early 2022. The timeline's a little bit fuzzy. I think around that time. And then by end of 2022 was when I started seeing adult oncology. So
How
about like several months.
How old were you at the time?
When I started seeing adult oncology,
Yeah.
19. Yeah.
Okay. Yeah, I think for me here in Maryland, I was seeing up until maybe I want to say 23. But I want to ask you how that transition was. Did you? So I know. I think you said so. You were on steroids, and what else was the treatment?
It was prednisone. Like, I didn't have to do any sort of like chemos or radiation, none of that kind of
So
stuff.
just
So
steroids.
I did like a it was from, I believe, from May till I think like end of July of 2017 was my steroid course, and it like it cured me. Like I did great in terms of the tumor itself. It shrunk like a lot of the tumors, except just like a tiny bit of like residual masses that ended up going away and dissolving on its own. But I was very miserable on treatment. I wouldn't, if God forbid, if I relapse again, I am not going back on steroid treatment because just personally, it was so difficult. I had a lot of crazy side effects during that time. I had a lot of mood swings. Steroids can affect mood. So having these like all of a sudden shifts in my mood, just I didn't like that. I really wasn't sleeping that well. Had like had a little bit of weight gain. I had like my face became very puffy and like someone I was 13 about to turn 14 at the time. I didn't want to be gaining weight. That was just something that I did not want happening. Well, I was during the summer break whenever, so I didn't want to spend my summer feeling miserable, but ultimately it did shrink the lesions. So the ones that were this one that was still bulging out, it had luckily shrunk it completely. And then the following year I had a PET scan and I still had very few like residual masses, but those eventually were not visible on my PET scan that I had in 2022, luckily. So it was the treatment did wonders for me in terms of like the disease itself, but I was so miserable on the treatment. And then while doing a taper dose, with steroids, you kind of can't abruptly stop taking the pill. You have to chunk down the dosages little by little and do like a gradual weaning off basically. During that weaning off period, I ended up having a seizure. I don't like, and at the time I didn't know why I had this seizure. And then my pediatric oncologist, they were like, oh my goodness, this could be histiocytosis involving the brain. Oh my goodness. And then that's when I got into neurology, saw them once, had a brain MRI, and then did an EEG. But luckily everything came back normal. And then that the seizure was never mentioned again. So up until I saw adult oncology, I did not know why I had a seizure. And then I asked my oncologist, I was like, why did that happen? And then he said it can sometimes like very rarely happen when tapering off steroids.
Okay, that's
Yeah.
really scary. I'm sorry. Go through that. So, would you say that your transition of care was a little, well, easiest relative, right? You had a lot of, but in that process of transitioning, do you think being your treatment only consisting of steroids, do you think it was a little easier to transition?
Oh, for sure. I feel that it was much easier of a transition, luckily, because I've heard stories from other patients transitioning from pediatric to adult care, and it is a bit of a hurdle. But luckily for me, I was already connected by some early summer of 2022 with the Histiocytosis Association. So I feel like having that resource made that a little bit smoother of a transition as compared to if I wasn't already connected with them. Or else at the time I wouldn't have known even what to look for and what adult oncologists would treat this. And luckily the Histio Association, the nice thing about them is that they have the little physician finder map. I don't know if you know what I'm talking about, Nate.
Yes,
But
yes, yes.
that was like a very helpful tool for sure.
Okay, awesome. Carter, I'm going to pass it back to you for our next segue. Yeah.
Okay, great. Actually, there was something you said earlier that really stood out to me about learning to own your diagnosis. And that's something I'm wondering about what that has looked like and what that's felt like for you.
Yeah, so I would say owning my diagnosis to me is like being able to reflect on everything that has happened. And yeah, it's definitely sad to think about it for sure, but I don't have these like physical, visible, emotional reactions anymore. Thinking about it, it doesn't put me in tears. It doesn't give me heart palpitations as it used to do whenever, or those early years of college when thinking about it. So I think I've really accepted everything that's happened. I'm at peace with whatever's happened and ready to navigate life outside and life after histio. I'm ready to take that on now and prioritize that. And I'm ready to share my story with others. I think that's something that's been a long time coming, and now I feel like I'm ready to open up. I'm not scared to open up. I'm not worried that I'll be perceived a certain way if I do open up and talk about my diagnosis. And actually, I've been pretty transparent about it with my med school classmates. If we've been having just like clinical related discussions, like I've been trying to contribute my perspective here and there within reason if it relates to the discussion at hand. So I feel like it's been very liberating in a way, just being open about it and being willing to talk to others about it. And it's just been such a crazy transformation from when my first few years of college, and then a little bit towards the end I wasn't talking about it either, to now just being so ready to share about it. And that came with, like, I had to put in a lot of work to get to this point. I put in a lot of work in therapy. I have a very big support system and just leaning on them whenever possible. And also, the biggest hurdle I would say when it comes to opening up and sharing my story was for my med school interviews. I would say, looking at my med school admissions and application process, the biggest challenge was, okay, how am I going to talk about my diagnosis on a Zoom call with people I've never met before? And some of them are probably going to be like physicians. So that was extremely daunting. I was like, I don't think I'm going to do this. I don't think I'm going to get a few words out without bursting into tears or just having emotional reactions to it, or just having it ruin the rest of my day because like I thought about it once and talked about it once. And I had to do a lot of practicing. That's when I started journaling a little bit, just to get a lot of my emotions out on paper. And then I did like a lot of practice interviews with a med school mentor of mine, and that was very, very helpful. And then come interview day, I think I interviewed at about like 4 or 5 different med schools. It just was I was easily able to open up and talk about it. And in that way, I feel like I was able to educate a lot of physicians as well through that way on what histiocytosis was. So I felt proud of myself afterwards. I was like, I was able to share this easily without, well, it wasn't easy, it was like very difficult for sure, but it was able to come out naturally. I wasn't scared really to do it in the moment, and all like while spreading awareness and educating other physicians. In one of my interviews, my interviewer and I had just a conversation the whole time about my histio and what it was and all that kind of stuff. So I think me sharing my story brought up some really interesting and important conversations during my med school interviews. And yeah, that's what kind of, I think, gave me the strength that, okay, I think I can do this.
Yeah, it sounds like you've put in a lot of hard work over the years to get where you are. Right?
Yeah.
You now have your degree in cancer biology. You just started med school.
Yeah.
What inspired you to pursue medicine?
Ever since I was a kid, I knew I wanted to be a doctor. I have several doctors in my family, so just seeing them do all the work, I was like, oh, that's something I want to do. But I didn't really know what my reason was up until I got the histio. And then after being diagnosed and I was sitting face to face with my oncologist, in my head, I told myself, I was like, okay, I am going to devote myself to this medical space. I'm going to enter this medical space, be a physician. I want to be an oncologist, study cancer, and mainly have a focus on these rare histiocytic disorders and serve that patient population and try to support them the best I can. I want to be their advocate. I want to be the one managing their care. So I think, so yeah, from that moment, 13, sitting at the oncologist's office, that's when the thought came to my head that like, okay, this is what I want to do with my life and this is my purpose. So talking about it now, looking back, I really think I transformed that painful period of time into like my life's purpose and my life goals. And I've been unstoppable since then. I never in college, I had a moment of a doubt that this isn't the field for me. And despite going through a lot of stuff with my mental health throughout the 4 years of college, I really focused on my schoolwork a lot and continued to just get involved with the histio community. And then I did a little bit of like research as well, and then volunteering, and that truly just kept on reinforcing why I wanted to pursue medicine. And yeah, and then I can't believe I'm in med school today. It's still so surreal just to think about it. But yeah, I know that I'm in the right place for me, if that makes sense.
That's just absolutely incredible. to
Thank
take
you.
this journey and to make something so big out of it. Learn to
Yeah,
not only advocate for yourself, but for all these other people.
thank you.
Wondering what your goals are, what you want to see change in this field, what you want to see differently for other patients.
Yeah, definitely. Just from all the different experiences I've had seeing providers and then shadowing as well. Was very insightful in college when I did that. But I've taken like bits and pieces of all of the physicians I've encountered in some way. And I've told myself that, okay, I'm either going to do this or I'm not going to do this. So, like, whenever I'm a physician, my goal is to be the physician that is resourceful to patients. If I am faced with diagnosing a rare disease patient that I'm not familiar with this particular rare disease, I want to put in the work outside of my hours and research and see what kind of resources I can offer to this patient. And if they're interested in taking the resources, or if they're not, that's fine. But I just want to be able to offer something. Yeah, I'll be able to treat them and all that kind of stuff. But I think it's really important to find resources and information that goes beyond the diagnosis, because that's a common hurdle I feel that we can all agree on as rare disease patients and survivors, that a lot of our challenges are unique and they go beyond the medical diagnosis, and medications and treatment can't fix a lot of the stuff that we deal with outside of the hospital and are outside of the doctor's visit. So I definitely want to be that provider that advocates for my patients, and that can offer resources, and that does the digging on my end to offer them stuff.
I have to say, I am so, so excited for you getting
Thank
into
you.
medical school and starting, and really excited for your future patients
Thank you.
because you have just such a wonderful approach to this.
Thank
And it
you.
just makes me smile hearing the way you talk about the kind of physician you're going to be.
Thank you.
Yeah, yeah, Brenda. I like what you said about. I don't remember exactly what you said, but it's the confidence in the way that you said it. That you are going to be an oncology doctor. You're going to work with rare diseases, and you've been crushing it in school. And I really believe in positive self-talk, and I really believe in confidently stating what you're going to be doing. And proof is in the pudding. Like I said, you're in med school right now, and you didn't give up even through all of those challenges. So I'm just really proud and happy to know you and to be advocating in this space alongside of you. I want to ask you, what does being rare mean to you?
Ooh, when I think of the word rare, the first word that comes to my mind is resilient. That's like that's a word that I like describe myself as, reflecting back on everything, like from having active disease to navigating life outside of histio, all while trying to like pursue my dreams and pursue my purpose from it. It's definitely resiliency, and even that's a word that I would use to describe everyone in the rare disease community, in the rare disease space, is resilient. Everyone is that's navigating a rare disease is so strong, and they navigate through their journeys with such grace, and it's such a unique challenge to try to figure out and try to navigate, but it's always just so inspiring to hear everyone's stories and talk to fellow rare disease patients and survivors and caregivers as well. So we definitely are a resilient community. So that's what rare, I would say, means to me.
Awesome, love that. And if there's someone out there, if there is crazy, because we know for a fact there are people out there right now who are struggling with their diagnosis and people who are unsure how to talk about it, what advice would you go to those people?
I would definitely say, if they're comfortable, like, don't be afraid of asking for help and leaning on your support system. I really feel like if I had reached out, if I had to and done like the research as we were talking earlier about support resources, and have like, if I wish I would have told my family, told my friends that, hey, I'm really struggling, then maybe it would have made that experience a little bit less painful than it needed to be. So that would be my advice to newly diagnosed patients or those that are struggling with their diagnosis, is to not be afraid to go to your support system for help, or just to try to seek out resources and try to build that community, and so you just can really see that you're not alone in your journey, and that there are probably others that can similarly relate to your experiences that you can kind of talk about.
That's perfect. And what keeps you grounded or gives you hope?
Ooh, what keeps me grounded, I would say, is definitely my family. As I mentioned earlier, they've been such a big support throughout this whole crazy health journey, and then as well, they're keeping me sane during my med school journey as well, and they've been very supportive in that, and they're happy to see me pursue this path and see me succeed. And yeah, so they definitely for sure keep me grounded. And what gives me hope is, I would say, our histiocytosis community of patients, caregivers, the histio physicians as well. I feel like I pull a lot of inspiration and hope from that community. We're a very small, resilient community. And yeah, so I just think of the histio community and them and everything I do. And even when starting med school, I wore like histio blue because I was like, oh, I want to be able to honor this community as I'm taking the steps to pursuing my medical education. So I really, truly do think of the histio community and everything I do. And I will continue to do that from here on out. I know in med school, I'll have challenges. I'll have days where I'm questioning probably why I've entered this field, but I know that I'll think of the histio community and it'll reinforce my reason for pursuing medicine. And then, yeah.
I just love, like Carter said, you're going to be like the best doctor. One of the things that we talk about, or I always like to harp on, is the fact that I think it's really important to have people who are passionate about the work in these positions. And you very much really are. I mean, for obvious reasons, of course, but like you can definitely tell. And you, as patients, I think it's really easy to tell the difference between people who are either going the extra mile or have that passion for taking care of you and people who are just showing up to work. And to me, they're not the same thing. So just because you are working in healthcare or any type of service to the people doesn't mean you're passionate about that service. Some people do, do want a paycheck. So I really just think that you're going to be fantastic for all of your obvious reasons. I want to ask you, if we strip away all the medical stuff, all the clinical stuff, and we're meeting Brinda as Brinda, first, what is your favorite or has been your favorite aspect about being in college and being on this journey outside of, the histio and the medical? And also, what is something maybe unique about you that people may not know? Or, if we were to say, or give you a prompt of rare and real, what is the real behind your rare?
Ooh. So I would say, medical stuff aside, thinking about college, what the highlight of it was, I would say definitely being in a very unique major, because my major is like the only one offered at the undergrad level in the whole country. So I already knew I was getting a very unique education. So getting into my major specific courses, my junior year and senior year, it was so fascinating getting to learn about cancer from all these various different angles. And I can connect them from like what I'm learning in my research lab about histio. So getting to draw and make those connections, I think was a very, very fun, honestly, part of my learning. So definitely the education I received, though it sounds super nerdy, that school was super fun, but really my cancer bio major and the classes and my professors, that was like the most fun I had in college. I genuinely looked forward to going to those classes. And yeah, so that's, I would say, the highlight of my college journey. And as I shared earlier, I started being okay with making friends more junior and senior year. So just doing activities with my friends and hanging out, going out for coffee. That's been a lot of fun as well. Yeah, so something unique about me. This isn't really unique because I feel like everyone likes this, but I love music. That has truly been such like a constant in my life. I love all different types of music, so that's like something about me. I really love music from like the 60s, 70s, like these fun oldies. And my favorite artist is Ariana Grande as well. So I've loved her music throughout my whole histio journey. So I've just constantly just grown to love her as an artist. But yeah, so that's a fun fact about me outside of school, medical stuff, healthcare. Yeah.
Wonderful taste. Before we wrap up, I have two more questions for you. One is the last concert you've been to. Do you remember?
The last concert. Okay, I like country music as well. So I saw Morgan Wallen last year, but my very first concert was Ariana Grande.
Awesome. Yeah. And what was the tour? It was your first one. Do you remember what tour it was?
That Ariana did, it was the Sweetener tour.
Okay, I same. My first and only time seeing Ariana Grande was the Sweetener World Tour. And how did that concert make you feel?
It was amazing. Oh my gosh. Just like you could feel such like a sense of like community in the arena. Everybody just was having so much fun. At that time, this was like 2019, so I was still like dealing a little bit of like my histio journey. I was experiencing like a lot of chronic pain related symptoms, and I was with my mom who also is a big Arianator. So it was just so much fun just to be in the presence of my favorite artist and listen to her amazing vocals live and just not have to think about stuff that's just going on at home or with my health and all that kind of stuff. So that concert, like I will never forget how I felt during and after that concert.
I feel the same way. I also love music, and something that I really enjoy is the moments when you're like at pretty normal, quote unquote, normal-ish things like concerts where people, people aren't there. You don't go to a concert. Ideally, hopefully, people aren't going to concerts feeling sick. So when you're there, it's like an escape away from that life, or like, oh, it's like, yeah, I finally get to like kind of feel like a person and normal people things in life. Yeah, and I really relate to that. And it's so crazy that we both. So Carter, I wanted to ask you real quick, what was the last concert you've been to?
Oh, I saw Dionne Warwick in Kansas City.
Ooh,
Yeah.
Yeah.
very nice.
How did that concert make you feel?
Oh, it was phenomenal. Just
Yeah?
absolutely wonderful. Yeah. That was actually, yeah, P and I were at the Global Genes Conference, and there was a lovely gentleman working at the hotel that we were talking to who offered us tickets for that night. And so we went like
Wow.
across the street. It was with the Kansas City Symphony. Just amazing night, like highlight of the year.
Oh my gosh,
Yeah.
that's an adventure if I've ever heard
Yeah.
one. That's a random adventure.
Spontaneous adventure, like the stars align.
That's nice.
Yeah.
Oh my god.
Oh, it's just magical. Yeah. My first concert was
Um,
Billy Joel, and
Oh my goodness, that's amazing. I want to see Billy Joel.
oh, he's so great. I love him.
it's
Are there
part
any
of
songs?
really having these experiences. Go ahead.
What was that?
I said it's you just casually having these crazy, these amazing experiences, just dropping them casually. Yeah. You had a question? Go ahead.
Yeah. Are there any songs you would put on a soundtrack to your journey?
Ooh, okay, this is not a Ariana Grande song or anything, but I definitely think Landslide by Fleetwood Mac. That's definitely one of my favorite songs.
So good.
And specifically the line that says time makes you bolder, I really like resonated with that because I truly feel like just time since navigating my journey has just really healed me in a way. I'm a stronger person now than I was 8 years ago whenever I was navigating through this journey. And then even I've evolved so much since then. And then even in the past 4 years in college, I've evolved so much. So I definitely think that specific lyric in Landslide by Fleetwood Mac, I truly resonate with.
Awesome, Brenda. We're compiling a list, so thanks. We're gonna steal that suggestion from you. And my last final question for you is there anything else that you'd love to share that we didn't ask you? This being the goal of this platform is to really bring people into firstly, what rare disease is and how people are living, and to try and, I think people have a better time understanding things when they can like make an association and they can draw some like relations to it. Not that everybody's gonna relate to our story, but I really want people to like to know that we're not just advocates harping on healthcare all the time, even though that's mostly what we do. We do have lives beyond that. We do have experiences that, normal humans can relate to. So I just want to make sure that, and the theme of that, and making sure that we really address you and all of you in the holistic version of you. Is there anything else that you wanted to make sure you mentioned or you put out there?
Yeah, not anything specific that I want to share, but I just wanted to thank the both of y'all for creating this space and for creating this platform for these open, honest, authentic conversations that go beyond the diagnosis. Like, I can't recall how many times from when I've seen various physicians. Still to this day, they ask me about the medical journey, but nobody asks, how did it make you feel? Like, what are some of these challenges that go beyond like the hospital or beyond the medical chart? Like, what do those entail? So it's honestly very exciting to have had the opportunity to come on here and just talk about my life, what makes me me, and how I am the way I am because of these experiences that I've had beyond the health aspect of what histio entailed, and getting to really open up about my journey with mental health and how that's evolved over the past couple of years. So thank you guys so much. I just wanted to say, for providing such a safe, authentic space for people to be vulnerable.
Thank you, Brenda. We really appreciate you being here. Again, you are our very first guest, our inaugural guest for SOS, which is really crazy. Yeah, I'm very happy to have you. It was really important for me to make sure that everyone heard your story and your voice, because you really touched me and impacted me throughout the years. So I just want people to like get a taste of what that's like. Again, happy Histio Awareness Month to everyone, to the Histio patients, the newly diagnosed patients, the patients who are in the hospital who their doctors have told them, you may have some type of histio. We're trying to figure it out. Anyone who's still trying to figure out what it is they have, and to the histio allies, the histio caregivers, histio families, histio providers, happy Awareness Month. And Carter, I'm going to let you close.
Yeah, thank you so much for joining us today, for being our first guest. It's been so wonderful getting to know you and getting to hear your story and who you are as a person. Thank you for being honest and real with us. It's been just such an honor to have you. Happy Histiocytosis Awareness Month, and thank you. And we'll see you all next time.
Thank you for having me.
Bye.
Bye.
Bye, bye, bye.
I'm losing myself.